And what happens when I miss taking my insulin injections and nothing has changed in my readings?
Well, that means your pancreas is probably putting out insulin. So that is a great time to get a C-peptide test. And if it's over 1, then you don't need insulin.
Hello, everyone. Welcome to the Fixed Blood Sugar webinar. We're going to wait a second for you guys to all hop on. We're excited that you're here on Zoom. Those of you on YouTube, thank you for joining us. You can post your questions there on YouTube. We'll get to as many of those. Well, we'll get to them when we can. Same with Facebook. Hopefully Facebook is going. Says it is. You just never know. You guys, today we are going to be taking your questions. And in fact, we're going to go through and answer some of the questions that were asked last week that we never got to. But we don't usually get to dedicate a whole webinar to a bunch of questions. And so this will be really fun. If you're on Zoom, use that Q&A. That's the easiest place for us to monitor the questions and make sure that we're getting through them, etc. Chat is just a great place to add some comments if you want. I think, what is it? Let me make sure we're good to go. All right, yes, we got quite a few of you on. Awesome. Hi, John, how are you? Dave is back from Columbia. Terry from North Texas. The Ungers are here. Snowy Utah. You know what? Snowy South Dakota also. In fact, my kids didn't have school Monday or Tuesday because we had, actually, I don't even know how much snow we ended up getting because we got 9 inches of snow from Sunday to Monday, and then we got more snow. So I don't even know where we're at anymore. It's snowing right now, so it's been crazy. And you know what? It always snows when my husband's out of town, so then we have to do all the snow removal ourselves. Not fun. I'm going to give you guys a quick disclaimer before we get started here. Our favorite doctor is going to be on the webinar, and he is not your doctor, unfortunately. So before you implement any of the things that we talk about today, make sure that you check with your healthcare provider. Dell is here. How are you, Dell? Good to see you. Jennifer from Texas, Elliot from Michigan, Dan from Ohio, Brenda from Maryland, Susan, Washington. Hi, Catherine. Huki from New Zealand. Welcome. Antonia from Texas. Monty's back from Idaho Falls. What session is this today? Actually, let me look. I'll double check that. Okay. I have been uploading webinars and we've been doing some summaries in the webinars as well. We've been doing a lot of cool things, you guys. In fact, my husband is part of the leadership team with Barton, and they have been together for the past few days in Arizona planning after we did planning. And so there's some really cool things I think that are going to happen this year. Let me double check on this webinar number so that those of you who maybe can't hang out the whole time or you want to go back and watch, you'll know where to go. So if you go to bartonwebinar.com, there's a link to our YouTube channel. All of our webinars are there. So we have a Healthy Heart webinar that Dr. Saunders does on Thursdays. And then this one is the Fixed Blood Sugar webinar. We have 225 webinars that we have done on type 2 diabetes. This is the 225th episode. So just a few things that we've had to chat about. And then we've also done 36 episodes on keeping your heart healthy. So much information on our YouTube channel. I just would really encourage you to go there. Again, bartonwebinar.com will take you to our channel. So again, episode, I'm typing as I do this, 225. And today it's all about your questions because questions are the answer. I think that was a book. Questions are the answers, if I remember correctly. So that's what we're doing today. Who else do we have? Oh my goodness, so many of you are saying hello. Jennifer from Texas, Barb, Michigan. I'm in South Dakota, Catherine. Someone is fantastic. I don't know their name. Wait, that's got to be Dell. That's got to be Dell. Yep. Allison from Florida. Almost forgot. Go Blue 2023 college football champions. Elliot, where are you? Do you live in South Dakota? Just curious. Sounds like you might, or you're just an SCSU fan. I will say, I went to USD, so I mean, I'm okay with them, but I am a coyote. I'm not a rabbit. Okay. Nora is here from Atlanta. Debbie, Maryland. Teresa from California. Lloyd, you're back. Hershey, Roy, Aurora, Colorado, and it's blowing hard with some snow in the wind, about 20-mile-an-hour temps. Oh man. Yep, sounds like weather here. Okay, Brad's here, Marty's here, Judy's here. Look at all you guys. Terry and Eve are back. You guys, this is awesome. So many of you. So exciting. Okay, we're gonna get started. Otherwise, I'm just gonna read these things forever. And I'm still probably gonna come back and say hi to most of you. But hello, Dr. Saunders. How are you?
Good morning. Well, it's morning for me. It's afternoon for you. I'm doing great.
Good. I'm glad. No snow in your area.
Nope, nope. It's beautiful. It's
Of
beautiful.
course. It's always beautiful there.
I
Um,
know.
we got a lot of questions for you today, so I hope you're ready.
Good. Yep.
I'm gonna we're gonna go through some of the questions that we didn't get to last week, but guys, if you want, post in the Q&A with your questions as we go, or if you have a question you've just been dying for Dr. Saunders to answer about type 2, we'd love to get those answered for you. So we're gonna just jump in. We've got a lot. So I'll kind of bounce between the two of these. I got a list from last week. So these are gonna be kind of random, and here we go. You guys ready? So this one is concerning fiber greens, which is our fiber supplement that Barton has come up with. And I can show you what that looks like. Or if you want to go to bartonwebinar.com, you'll find a link to our fiber supplement. Salome is asking, Salome found that it says, I found that my pulse raises to high numbers after drinking the fiber greens. What do you suggest I do?
Um, the question is why? Why does the pulse go up? So the pulse can go up if you have if you don't have enough liquid in your diet, if you don't have enough salt, if you're dehydrated in some way, dehydrated being a lack of sodium, a lack of potassium, a lack of water. And if it goes up with the fiber greens, that's unusual. I don't know why that would be, unless the the artificial sweetener stevia might be causing you to release extra insulin, which can drop your blood sugar a little low, and then you might have hypoglycemia, which could cause a racing heart. So yeah, those are all possible. Last weekend, I do 3 days a month fasting, and several times during that time, I could tell I got hypoglycemia just because of some mild dizziness and some palpitations of my heart. And so sometimes if you have severe hypoglycemia, that's when you're like on the floor and passing out and all that stuff. But mild, it could be just your heart beating more.
Okay. I'm going to show you guys our fiber green supplement. And also Dr. Saunders mentioned fasting. So I'm just going to, because I know there's questions in here about fasting. Is fasting something you recommend?
Absolutely. If you look at all the things you could possibly do for your health, the number one best thing you could do is fasting. The worst advice you can give to a human being is what they're teaching in nutrition schools: eat 5 small meals a day with snacks in between, so you never have an empty stomach. So you never get hypoglycemia, because that's bad. Your heart might beat too hard. And in reality, fasting is everything good that happens while you're fasting. So it suppresses stress. It decreases all the cortisol and all the adrenal hormones that cause damage. It gets rid of your catabolic metabolism that breaks down your body and causes wear and tear. It starts the anabolic metabolism, which is where you get repair, cleanse, detox. People think they're going to cleanse and detox by eating all the crap they normally eat and adding in this little shake or something, or tea or something, that they're cleansing. That's not cleansing. Real cleansing is fasting. When you fast and you're not putting anything in your stomach, then your liver can start using up the glycogen and taking out all the bad fats and taking out the toxins and removing the dead cells and removing the cancer cells. All the detox happens while you're not eating, while your stomach is empty. So the single best thing you can do is to have an empty stomach. Because that's where all the repair happens. That's where all the good things happen. That's where all the cancer is prevented. That's where all the diabetes is prevented. Heart disease, everything you can think of that's good for you happens while you're fasting. So, what about exercise, Dr. Saunders? Exercise is really important, right? Yes, absolutely. But exercise has a totally different purpose. Exercise keeps you fit and active. If you want to stay out of a nursing home, exercise. That's the single best way. You need to exercise to stay on your feet, to remain active, to maintain your abilities to do things. It's not the same as fasting where you're repairing every cell of your body. In fact, exercise, you're damaging your cells of your body. Literally, you're wearing out your knees or whatever joints you're using, you're actually wearing them out. You're tearing muscle fibers, you're tearing tendons. That's a catabolic activity, exercise. And so you have to then fast to repair all the damage you did while you were exercising. So you still need to fast. There's just no replacement for that.
All right, awesome. I'm going to share Art Nutrition, which is all of our supplements. Let me make sure I'm sharing the right one. Here we go. So we were talking about fiber greens. Here is what someone had mentioned earlier, Salome. And then also, actually, I'm not sure if it's Salome. I think that's what the name was. I might be pronouncing that wrong, so I apologize. But the next question that we're gonna answer is from Francis. And Francis is actually asking about berberine. So let me show you where that is on Barton Nutrition.
So by the way, the fiber greens is not recommended while you're in phase one.
Yes.
It's phase one is to avoid things like artificial sweeteners, and the fiber greens has an artificial sweetener, stevia, in it. So you can avoid that.
Yes. And guys, we actually have a link at bartonwebinar.com that has, or we have a little section that has all of our top asked questions. Highly recommend that you go check that out, especially if you are not familiar with our webinars. Maybe you've only been here one or two times. You're going to find a lot of really good information there. Dr. Saunders will even dig in more about why we're not going to do sweeteners, which he touched on in phase one. We talk about why sometimes our numbers are higher in the morning than they are in the day. And just a lot of questions that come up on every single webinar that we do. Here is our berberine supplement. And Francis says, can you take berberine every day, or do you have to have a 2 to 4 week break every 8 weeks that is mentioned on Google?
Okay. Yeah, we talked about this last time. It's good to have a break. If you don't take a break, then your body kind of stops absorbing it, and you become desensitized to it. So if you do like 8 weeks straight, then you do a couple of weeks off. That's a way to do it. I've seen other studies where they have 1 week on, 1 week off. That works okay too. But there was another study that was 5 days on, 2 days off. And so having 2 days off every 5 days is roughly equivalent. I mean, if you add it all up, the weeks, you can do the weeks, and that's okay too. But I think it's easier, and the way I do it was the 5 days on, 2 days off.
Okay. Tim says, let's see, Tim from Studio City, California. My glucose has been 123 to 125, never above 180. I'm having a C-peptide test. What is a good reading to look for? And what happens when I miss taking my insulin injections and nothing has changed in my readings?
Yeah, that's a really interesting question. Okay, number one question was
C-peptide.
what's the C-peptide level that it should be? Well, if it's fasting and your blood glucose is normal, like 70 to 90, then it should be around 1. If it's higher than 1, then you make insulin enough that you don't need to inject insulin. So I have a patient who has type 1 diabetes. It's autoimmune. About 2 years ago, she came up. She's 20 years old, and And they had her on this regimen of injecting 5 times a day and checking her blood sugar, and her blood glucose was all over the place. She had no insulin at all. We tested, and but I tested her and found out she had um, pancreatic disease. It's an islet cell antibodies. And so we put her on an autoimmune protocol. And now it's been 2 years, and the last test that she had in December showed that she's making insulin. Her C peptide is now 0.9, which isn't a lot when your blood sugar is over 200, and hers was. But it's enough so that she is now off insulin, and she's on a very low carbohydrate diet. She's on phase 1 of the program, and she's managing to keep her blood sugar, or her blood sugar around 200 at this point. So, and that's a start. Anyway, so that's the issue of what does it mean when I don't inject insulin and my blood sugar stays the same? Well, that means your pancreas is probably putting out insulin. So that is a great time to get a C-peptide test. And if it's over 1, then you don't need insulin.
Right. Good stuff. Annabelle says hi from Indiana. Verna's here from Idaho. Maria, Massachusetts. Paul's here from Toronto. We have Etta on. Beverly is here. John's here. Melanie from Colorado. Okay. Michelle says, I have the diabetes solution kit for reversal. And this is the diabetes. Oh, that's the healthy heart. My other one's over here. I gotta grab the other one.
It looks the same.
They do look the same. They look the same, but the diabetes solution kit. And Michelle says that I was disappointed in the recipes, not functional for vegan. Oops. Okay, not functional for vegan pre-diabetic. And we talk about this a lot, actually. Dr. Saunders, for example, has done a year where he was vegan, and the beauty of this is these were just a few recipes for the general population. I would say most people, these were the easiest recipes that we found, but there's so much available online. If you were low carb and you wanted to do vegan, you could find really good stuff. Dr. Saunders, what thoughts do you have about that?
Okay, so I have patients that are vegan that I start on the program, and I go to a website. It's called Vegan Keto. I think it's veganketo.com. And it has a whole bunch of vegan recipes. It has lists of foods that are on the keto diet that are vegan, because people always think of keto as meat and eggs and fish and all the things that are not vegan. They're high protein and fat. What about all those high fiber foods that are low in carbohydrates, low in sugar? Stuff like broccoli and lettuce and spinach and cucumbers and all the salad stuff, for example. So there's a lot of vegan stuff that you can get, and just look up online vegan keto. Yes,
Okay.
there isn't a lot of vegan stuff in our book. I've noticed that.
Yeah. Okay. Elliot, I thought you were talking about SDSU. They just won. They just came back from winning. Would it be the FCS?
San Diego State University.
No, South Dakota, but they actually just won. Oh boy, I don't know what I want to say FCS or something like that, but they just won too. So that's what I thought you were talking about, because they're blue. So that's where my mind went. But anyway, okay. Mark's here from California as well. Linda says, I'm a type 2 diabetic and I've been fasting for a year. And I eat 1 meal a day. And so I thought you hadn't eaten in a year. I was confused when I read that. Sorry. I've been fasting for a year. I eat 1 meal a day and sometimes 2 meals a day. And I have chronic GERD. And since have been doing that, I've been having a lot of problems with my stomach. What should I do about it?
It would be a good idea to find out why. Some of it, sometimes eating, sometimes 2 meals a day. If you're not consistent with your meals, then you can stimulate acid production. Sometimes there's other reasons for acid production. If you have a lot of histamine, for example, and you don't have the DAO enzyme to break down the histamine, then you make more acid in your stomach. And if your stomach's empty all the time, making a bunch of acid is really irritating and can cause that problem. So, an empty stomach with acid, you have to ask the question why? Why is it there? Because that's not normal and shouldn't be there. So, is it some kind of allergy, some food you're allergic to? Are you eating a lot of things that are high in histamine? Or are you missing an enzyme or two or something like that? Sometimes I start with it's called an upper GI test, where it's an X-ray actually, where you drink this contrast material and it goes down, and they take X-rays of it going down to see how the esophagus is working, and then they lay you down and see if acid comes up into your esophagus, see if they can see from the contrast material, and then they can look at the stomach and see if there's any ulcers or anything. And so it's a pretty good functional test, and you don't have to have that scope put down into your stomach, gagging on it and all that. So it's less of a procedure than having the scope. And in some ways, it gives you more information. It just gives you different information. So finding out why, find out why you have the acid. That's not normal. If you're eating 1 or 2 meals a day, your acid should shut down completely for the rest of the time, and that's what we're looking for. So if you're not getting that, then find out why.
Okay, Monty said from last week, I know we can get magnesium through foods, but if we're going to use a supplement, what should we do? Take capsules or take the Barton spray of magnesium? What do you think is best? Taking capsules or spray?
Okay, there are so many capsules available, so many types. You can get magnesium citrate, magnesium glycinate, magnesium oxide. There's just so many different kinds. People go, okay, what's the best magnesium? And then these people that are marketing stuff, they say, oh, ours is the best. This is neuromag, and this gets into your brain and makes your brain function better, and your mitochondria, you get better energy in your brain. And it's all marketing stuff, because they get a slightly more absorption of the magnesium glycinate than you get of the magnesium oxide. So you're getting less of the magnesium oxide. Well, big deal. Take more magnesium oxide, and then take 800 milligrams of magnesium oxide. Then you get the same amount ultimately, right? So it's a lot of that stuff is marketing. So we have a spray. Why do we have a spray? Because we found people weren't able to find it easily, the magnesium spray, and I was recommending it to a lot of people because some people get diarrhea when they take magnesium. And so if it kind of causes diarrhea and you'd rather not deal with that, then use the spray. So there's a reason for one and a reason for the other. It's not like one is better than the other. The spray is, I don't know, for some people it's not very convenient. You got to spray a lot. You got to like, you're working out your pumping finger when you're spraying it.
It's not warm. It doesn't go on warm. So.
Right. It's 100. It's like 100 spray. You're putting like 50 sprays on it. So, anyway, so yeah. Either way, it's okay.
I do use the spray. I use it at night, and it is, you got to find a lot of skin to get all those sprays in. So, okay. Harry said, I read in 3 different places with the diabetes solution kit concerning supplements, and it's a little confusing. Harry says that synochroma should be taken twice a day for 90 days, and then says that supplement should be taken only 5 days per week. Is this contradictory of the above?
Okay. No, it's actually the very first question we had was about taking
Berberine, I think.
berberine, right? And so the 5 days on, 2 days off, that's a maintenance thing. That's where you found it. You found that in the maintenance section after you've finished your 90 days, and then take it for 5 days a week. That's good. So during your 90 days, yeah, once or even twice a day. A lot of people are taking it twice a day. That way you're getting a pretty high dose of vitamin Ds, you're going from 5,000 to 10,000. If you're taking 2 synochroma a day, one in the morning, one at night, you're getting 10,000 of vitamin D. We formulated this for to be once a day at breakfast. And some people say, well, can I take it twice a day? Yes, you can. And you're not going to overdose. That's just the higher dose. The once a day is enough, and the twice a day is more than enough.
Harry, I had a question from you last week too. It said, I heard prickly pear cactus is good for diabetes.
I've heard that too. I've heard nopal, and when I was in Mexico, they were telling me a lot that people say, "Oh yeah, I have diabetes. I treat it with nopal." And that's actually the leaf of the big leaf. They cut it up, and it's kind of slimy. I don't even like it.
Interesting.
It's kind
Okay.
of like eating okra, if you've ever had okra.
Yeah. Interesting. Okay. Let's see. Someone had said, is Melissa, who's doing the Daily Health Explorer, part of the Barton team? Yes, she is. She is. Monty had also said, I read about ashwagandha, olive leaf extract, and beetroot. Can you tell me how important these things are for diabetes or heart health?
Well, we included them in the Healthy Heart supplement because they do certain things that help for heart health. So for diabetes, though, we didn't include that in because that's a separate issue. So I don't. Those might help. So ashwagandha, for example, lowers the stress hormones to some extent, which is beneficial for your metabolism, and it decreases the insulin resistance that you get from having high levels of cortisol. We put those in Healthy Heart specifically because there, out of all of the heart supplements there are out there, no one had this combination of things that we wanted to increase nitric oxide, lower stress levels, and increase the mitochondria. So we had a goal for making this supplement, and that's what we included in it.
Okay. Good question here from Tom. Can a thyroid issue be affected by glucose issues?
Oh, that's a good question. The answer is, of course, could it be? Yes, but indirectly. So in the same sense of when people have a lot of stress, they can get insulin resistance and have glucose issues. Having extra cortisol causes you to be less sensitive to your thyroid. So you actually what it does is it blocks an enzyme. So there's an enzyme called deiodinase that takes the T4 and makes it into T3. T4 is not is making in your neck is T4. So you get the T4, but it doesn't do anything. It swims around in the body, and then your cells take the T4 and they go, oh, I need some thyroid. So they use this deiodinase enzyme to make T3, which is the active form, and then everything functions. You get energy and all that stuff. The stress blocks that enzyme, so you can't make the active thyroid hormone anymore. Well, it's not none. You just decrease the amount of active thyroid, so your thyroid level drops. By the way, you also get insulin resistant and you gain weight, which causes insulin resistance. So there's a lot of effect there, but indirectly. It's not like this one causes that one. It's really, that would be an adrenal problem that can affect both of them, or the big picture.
All right. Okay. So many questions in here, guys. These are really good questions. Hopefully we can get through these. Julie had asked last week, if I'm taking cholesterol lowering medications, can I still take CoQ10?
Oh, absolutely. In fact, you should. Thank you. Okay, so what she's referring to is cholesterol lowering medications block the production of CoQ10. So CoQ10 is not a vitamin. We make it inside our bodies, and we make it out of cholesterol. And if you don't have cholesterol, or if you're taking something that blocks your cholesterol, you're not going to make CoQ10. So what does that do? Well, you have less energy. Your heart doesn't work as well. Your muscles don't work as well. Your mitochondria, you decrease the amount of mitochondria. You're just going to lose energy over time, and things are not going to function well. So there was a drug company, I believe it was Pfizer. It's been many years since I saw it. That they actually patented a statin CoQ10 combination. And then they did some research and proved that it worked, and they decided not to market it. Why they decided not to market it, they didn't say. They just said, we're not going to market this, but it did have a patent. So yes, take CoQ10 if you're taking a statin. I don't recommend statins, but if you're taking one, for heaven's sakes, take CoQ10.
Okay. Elliot said it was just prescribed metformin yesterday. So have you started it, Elliot? My A1C was 7.6. Let me see. Is berberine the best on your website? I cannot find it in a local pharmacy. I mean, I would say
Oh,
yes.
well, yeah, I don't know how to judge the best, but I personally visited UST, where we get the supplements from. The whole team went there, and they showed us their facility, and they showed us how they analyze things. So a lot of places, and this is not uncommon. In fact, our own team, because Synachroma is so popular, they're doing a fake Synachroma in China, and they sell it on Amazon. And so people say, well, I can get Synachroma cheaper on Amazon. I don't have to get it from you guys. And but you know what you're getting, you don't know what you're getting. You know, they put melamine in it. They put stuff in it that you don't want in your body in these little capsules. And one of my patients called me and said, you know what? I was getting Synachroma, and I found some on Amazon. I got it, and the pills are white and not the normal brown color like they were before. Why are they white? And I said, if you got it on Amazon, don't take it. It's bad stuff. So when we go there, and he told us about the cinnamon, for example, there was one of the laboratory technicians was in there, and they have a microscope, and they're looking at the under the microscope when they get a shipment in, and in this case it was cinnamon, and they take the cinnamon, they look under a microscope, and they can tell if this is ground cinnamon because that's bark, and if it has something else in it like talcum powder, they color the talcum powder the color of cinnamon, and they put it in there as if it was cinnamon, so that they can lower their costs, so to speak. And so they look, and if it has any talc in it, they box it back up and ship it back and say, no, we're not accepting that. So berberine, same kind of thing. It gets tested before, and then after it's all put into the capsules, they take individual capsules out and test them. Does it have what it says it has in it? Does it have the amount it says it has in it? Does it have anything else that shouldn't be there in it? And they test it. So I would say absolutely. You know, I trust it. I take it.
All right. We have a question here that says, when it says to take two Synachroma or two berberine or two Nervala, is that two at the same time in the morning, or do you take one of each in the morning at breakfast and then one of each at dinner time?
Thank you. I don't know why that's not clear. That should be made very clear, because separating the berberine is important. Separating the Synachroma is less important, but it's also, excuse me, a good idea. So yeah, they should be separated. Take one with your morning meal, and then one with your afternoon meal.
And that was something that actually came up in our team meetings that we had when we were in Florida a few weeks ago, just to help make that a little bit clearer for those of you who maybe are taking more than one supplement. And so we're working on that. In fact, I'm taking a note to kind of check on that progress. Sorry, I can't talk and write at the same time very well. talk and think. That's what I meant. Can't talk and think. Okay. I have an email here from Michael. It says I got rid of my 2,000 milligrams of metformin per day, where my blood glucose was in the 140s. Still taking synochroma for 2 years. My blood glucose went into the mid 200s. I doubled my synochroma and added berberine with Ceylon cinnamon, and now my blood glucose is in the 190s. What would you recommend I do now to get it in the 120s?
Okay. I would say shoot for the moon and go between 70 and 90. So for those of you who are in Canada, because we have quite a few people in Canada, that's between 4 and 5, so or 3.8 and 4 point whatever. So right 4 point something is what he's talking about, is the optimum, like between 70 and 90. The 120s is going to be like 5.5 or 6.0, somewhere in there. So if you're in the one, to get it down to the 120s, it's really simple. Do phase one. Just get the book, do phase one. So you're talking about that you're taking this pill and that pill, and getting off your drugs, and adding supplements as if they're going to take the place of the drugs. That's not their purpose. Their purpose is to assist you to make sure your body can use glucose efficiently. And then if you do, then it'll be easy to do phase one of the program, and get your blood glucose down to normal, not to 120. 120 is not normal. Get it down to normal between 70 and 90, or if you're in Canada, between 4 and 5.
And you can find that at bartonwebinar.com. Use code webinar25, that's one word, and you'll save 25%. Okay, Verna says, how do sugar substitutes affect non-diabetics? My husband is wondering.
Okay. It causes insulin resistance over a period of time. It causes weight gain, and insulin resistance. And this is I didn't just make that up. Research has been done since the 1970s with Diet Pepsi, I think was the first one. They refused to publish the study because people on the diet sodas gained more weight than the people on the sugar sodas. So they wouldn't publish the study. There have been since several studies to show that very same thing, that you're going to gain weight, you're going to get insulin resistance if you use artificial sweeteners.
There was another question about sugar substitutes. Let me see if I can find it. I'll have to look for it again. Elliot had heard that it's not good to take magnesium and zinc on the same day. Is that true or false?
Okay. Calcium, magnesium, zinc, copper. They're called divalent cations. Divalent means they have a 2+, and that 2+ divalent cation is absorbed by the body, and calcium is in there too. They're absorbed by the body by the same mechanism. So if you take them together, they don't get absorbed well. So separating the minerals is going to improve absorption of some of them. So for example, if you take zinc every day, you're not going to absorb copper. And it's not because it like inhibits copper, it suppresses it. It's because you're taking 100 times more zinc than copper. And so that 100 times takes up all of the absorption enzymes. They're not enzymes, proteins. And so the copper has very little ability to be there. You're going to still get some copper, but you're going to get very tiny amounts. So when somebody has, for example, a copper storage disease like Wilson's disease, there's only one treatment: take zinc, so you won't absorb any extra copper. And so taking zinc every day prevents you from absorbing copper. So then you take these supplements and you go, oh, well, this has zinc and copper. Well, that's great. I need both of those. Well, you're gonna absorb the zinc and suppress the copper. So it's not a good way to go. So there is, like, calcium, magnesium, same issue, and zinc is in there. And so here's the way to do it: just eat regular food. And if you need a supplement, so for example, magnesium is a common deficiency. So that's why we have magnesium. And it's so much better to get it from food. And magnesium is found in everything green and everything that grows. So if it sprouts, so if it is a nut, a seed, a grain, anything that you can put in water and sprouts is going to have magnesium a lot in it. So if you take a grain though, and you take the germ and the bran off, then you take all the magnesium out of it. So that's why white flour has essentially no magnesium. And white rice, essentially no magnesium. But if you keep them whole grains, then you get magnesium. So nuts and seeds, whole grains, and anything green.
Right. Mariette says, I have had 2 strokes, so I'm pretty sedentary.
Ooh.
What would be the best exercise for me?
Okay. The best exercise is being on your feet and walking. So there's just nothing better than walking. So if your stroke makes it impossible to walk, then you have to find another way. So that would depend on your physical therapist. And the best exercise is the one you can do. And especially if you can improve. So for example, my mother-in-law had a stroke, and she was paralyzed on one side, and they had to put a brace on her ankle, a brace on her knee, so that she could hold on to a walker and limp around. But that was really important. It was hard, but that's really important, because as you're limping around, even though it's really hard, you're building up the ability to use that side. So and it does happen. Not because your brain grows back. That's not what happens. The brain's way of healing is to work around an issue. So you have a stroke, and then that kills off these neurons that normally control the right side of your body. So what the brain does then is says, oh, we'll use these ones over here and connect it to those ones over there, so that we can bypass these ones that are dead. If they're dead, they're dead. They don't come back. And that's pretty clear, because if you look at people with polio, they had polio in the 1930s when they were 6 years old and all that, and they were paralyzed, for example, from the waist down, and then they got better. And they lived their entire lives. They were working and running and doing things and running around, and no problem. And then they got older, and all of a sudden their polio came back. And it's like, what the heck? What is post-polio syndrome? Well, that dead part of the brain that the virus killed is still dead. But the getting better is the brain worked around it. Well, now as you're getting older, you're losing those brain cells, and now you just can't work around that dead part anymore. And so the symptoms return, they come back. But that's really just, they were always there. The brain worked around it. So when you have a stroke, you just work as hard as you can to teach your brain to work around it.
Very interesting. Okay. Anonymous has said, what do you think about pili nuts and sacha inca nuts or seeds? Any ideas? I'm not familiar with them, so.
I don't know enough. I mean, I've heard of them before, but I don't know enough. I don't know anything about the content of them. Um, I don't know how much like fat, carbohydrate, protein, or nutrients are in there. They've got to have magnesium because they're nuts, right? So at least that, but I don't know.
Okay, I see some people are wondering if I'm going to get to their questions. I have 22 questions left, and I have 13 minutes. And then I also have the list from last week. So I don't
one
know
every
if it's
30
going to
seconds. Let's go. One every 30 seconds.
From Rosalind, I've been doing intermittent fasting for a couple of weeks. I was on the Dexcom 7 trial. For some strange reason, my blood sugar for the last 2 weeks has been awesome. I wake up from 74 to 98 blood sugars, and I don't know what happened or Yeah, for some reason, when I eat fat, it drops. Can you help me understand what could be happening?
Okay, when you eat fat, your blood sugar drops. Fat slows the absorption because it slows emptying of the stomach. It slows the absorption of sugar too, and so you don't have spikes of sugar. And so as you're gradually absorbing sugar, you're gradually using the sugar, and all of that comes together to allow your blood sugar to be lower. So I suppose that would be why.
Good question from Edwin. I do not need to lose weight at all. Do I need a unique diet?
Um,
Under the
well,
assumption that they have type 2 and
yeah,
they
yeah,
don't
that's
need
what
to lose
that's what
weight.
I'm thinking. If you want to lower your blood sugar, if you have a blood sugar issue, then here's what you do. I've been reading a book on this. We talked about it, the Circadian Code by Sachin Panda, and he discusses that how to keep your ideal body weight and lower blood sugar and lower belly fat and lower insulin resistance. All you need to do is keep eating. You could even eat the same amount, but just decrease the amount of time that you eat. So if you eat at 8 and noon and you're done by noon, then you have then 8 to noon is 4 hours. So you're going to have 20 hours of, of, of no insulin to lower your insulin resistance, to improve insulin sensitivity. So that would be the best thing to do. Decrease the amount of time you eat. He recommends about an 8 hours. So if you eat at 8 a.m., 4 p.m., that's kind of an optimum place to be. People always want to move it to, can I move it to 12 and 8? No, no, it should be 8 and 4.
Okay, so when you're fasting, Terry wants to know if you should stop taking metformin and insulin.
Um, Stop taking it. Yes, yes, definitely insulin because you're not taking any food in, and insulin will make you hypoglycemic. Metformin, it's not going to be a big deal one way or the other, but yeah, don't take it while you're fasting, either of those.
Okay, I had a question about phase 3, and we'll be talking about that next week. So just letting you know, we did phase 1 of the diabetes solution kit, phase 2, and phase 3 will be next week. Jerry says chocolates. Let's discuss the difference between milk chocolate, white chocolate, and dark chocolate, and the differences between USA, Canadian, and European chocolates. Should we even talk about chocolate? What do you think?
No, no, I personally don't think we should talk about chocolate
Okay.
because um, personally, the idea of changing is really changing. Is really okay. I don't do that anymore because I have an issue. So for me to deal with my blood sugar issue, I'm not going to eat any processed sugars at all. And then artificial sweeteners are really off the table too. So yeah, I know we talk about okay, if you add chocolate in, then it's going to probably be better dark chocolate and once a week or something like that. And people do. Some people say, okay, my wife was like that. I can't get away from my Sunday chocolate. I just on Sundays I just want to relax and enjoy some chocolate. Okay, fine.
Okay. What are your thoughts on Irish sea moss? I swear we had that question recently.
Yeah, we did. And I don't have an opinion of it. I I think it's high in iodine, but I don't know. I don't know enough about it.
Okay. How does a low carb diet affect the liver?
Um, the liver has to process the sugars and hold on to sugars. The liver makes glycogen out of sugar. So when you don't eat sugar, it cleans out the liver. It cleans the glycogen out of the liver and helps the liver to function better. So actually, a low carb diet is very good for the liver.
Monty says, as you know, I'm doing an extended fast. I've stopped taking losartan. You mentioned that my blood pressure numbers should come down, but this morning I took my blood pressure. It was 165 over 82. I have not seen it really come down that much, and I have the blood sugar, and I have the blood sugar numbers. Also, even though I have had low blood sugar numbers, I get it still bumping up at about 8 a.m. and takes a few hours to come down and then levels out at about 110 to 120 for the day. This is fantastic to me, but it just does not seem to come down to 2 digits and hold. I'm probably so insulin resistant. What do you think I should do? Side note, I've now lost 27 pounds since the start of December.
Wow. Wow.
Wow,
Good
that's about a
work,
month.
Monty. That's
I'm thrilled
amazing.
about this, but this is not a diet program to me. This is a health journey. Thanks in advance.
Okay, awesome. So the answer to that is there might be a connection between the two, connection between the blood glucose going up in the morning and the blood pressure going up in the morning. Those two things might be the same issue, and that is if the insulin or the adrenaline and cortisol are going up, then that's going to make you insulin resistant and cause the blood sugar to go up just because your liver is making extra glucose. That's what it's doing. It's not because you ate it, because you're fasting. Your liver's making it, it's taking all that glycogen out. So that by itself is not a problem, but it does indicate that there's some stress issues to deal with. And so in that case, the best way to do that is to get a really good circadian rhythm. Go to bed by 10, wake up by 6, so you have 8 hours in bed. And then, well, you're not going to eat, and then have bright lights. Exercise is a great way to bring that down in the morning, is to exercise in the morning. Brings the cortisol, the adrenal hormone levels down. Because this sounds like an adrenal hormone issue and not something worrisome. So for example, your blood pressure 160 over 82 is like, that's not bad at all. That's an okay blood pressure.
Harry says, is berberine okay to take with metformin, or should you take one or the other?
They're okay to take together, but you know what? They do the same thing. You might as well just take one. That decreases your risk of having any issues like muscle pain and liver problems, so, or liver enzyme elevation. So just take the berberine. That's what I would do.
Melanie wants to know, how long should you fast?
You should fast as long as you want to. There's no downside. There was a guy in 1968 who weighed 480 pounds, who went to his doctor and said, I'm going to quit eating till I weigh 180 pounds. And he holds the record for fasting at 380 days, something like that. It's over a year. I think it's like 380 days. And uh, uh, and so 5 years later, they went and looked him up to see how he was doing, because he was in Scotland. And he weighed still 180 pounds after 5 years of eating a normal diet. So after he had fasted for over a year and just living on his own fat. So if you have fat to live on, you can live on it for as long as you want.
Okay. Huki says, are blood vessels able to be cleaned naturally?
Oh, yes, absolutely. And they should be cleaned naturally. So the cleanse and detox program is having an empty stomach. When your stomach's empty, you repair and you do something called autophagy. Autophagy is auto means self, phagy is eating. So you're eating yourself. Because you didn't eat anything on the outside, you're going to eat everything on the inside. And guess what gets eaten? Well, all the junk stuff that's been hanging around, like the stuff in your arteries and the cholesterol deposits, because remember, cholesterol is an absolutely essential ingredient for life. So all of the dead cells get eaten up. All of the arteries get cleaned out. Everything gets cleansed and detoxed during the time that there's nothing in your stomach.
Roy says, when I fast, no food or drink for 3 days, my mouth gets really dry. Is it okay to sip water, swish, and spit without swallowing, or does that defeat what I'm trying to get done?
No, swallow. Drink the water. If you're that thirsty, drink a cup of water. No swish and spit. Drink a cup of water. Yeah, you don't need to get dehydrated. The water empties out of your stomach within half an hour or so. It's a minute. It's not very long. And then you're right back to fasting again, and it's okay.
So is it good to do all supplements 5 on and 2 off?
Um, no, we have supplements. Yes,
Yeah.
supplement. Remember, that's not treatments. If you're treating something, so for example, when you're first starting in phase one, then you're going to use the synachroma once or twice a day, every day, until you get down to a normal level, and then you're going to go to the 5 days on, 2 days off.
David said if I interrupt berberine, say every other week, should I take metformin in those weeks?
If you, no, there's no reason to do that.
There's a difference, I think, between the treatment and the maintenance phases. That's kind of
Right.
what Dr. Saunders is saying. And so if you're using it for treatment, that's different.
Yeah. Yeah.
You might want to do the 5 and 2 for treatment, right? Well, berberine, you do that for treatment too, probably.
Yeah. Well,
Okay.
no, for treatment, you do
berberine?
it, yeah, continuously.
Okay. So
Yeah.
then, yeah. Hopefully you won't need berberine and metformin. We did just talk about that a little bit too, but okay, Brenda said I test my blood glucose each morning and notice that if I eat less and early in the evening, my number is usually low. I'm not on any medication. I refuse to take metformin or glipizide. How can I continue to have good numbers each morning?
Well, you just said it.
Yeah.
And we've been talking about doing an 8 hour window of eating. And eat at 8 o'clock in the morning, eat at 4, and then don't eat anything after that. You can have a sip of water, a cup of water, whatever, and you'll have great numbers.
What do you think about tea and coffee with caffeine in it? Any thoughts?
Tea and coffee. Well, the caffeine isn't a big deal for most people. Some people have an adrenaline response from the caffeine and get shaky, and then the blood sugar goes up. So that's kind of an individual thing, but most people tolerate coffee or tea pretty well.
What do you think about hot drinks? Or please explain the hot drink thing for me about the blood sugar being affected while drinking it before, during, or after meals.
Hot drinks. I don't think it's the heat. I don't know personally. When I looked at that, it's what people put in it. I mean, if you're drinking a hot coffee that's got this much coffee and this much cream and this much sugar in it, and it's more like ice cream, coffee flavored ice cream than anything, and that makes the blood sugar go up. So it's not the hot. In fact, most of the time I tell people that are on phase one that they can drink herbal teas and hot, and that doesn't affect their blood sugar.
Oh, you gotta go. Okay, let me see here. Anything else I can quick do? We've talked about, some of these are too long. How about drinking red wine every day with dinner? Any thoughts on that?
Avoid it. You know what? I've had a lot of people tell me that. I just want to have my red wine with dinner every day. Well, no, if you're gonna have red wine, move it to like early afternoon, like 2 or 3 o'clock in the afternoon. It's not a good idea to have any time near bedtime in the evening. It's not good.
Okay, Dr. Saunders, thank you so much for answering all these questions.
You're welcome.
It was a full day. See you tomorrow.
All right. See you tomorrow.
Bye. Okay, so there's still a lot of questions we couldn't get to, guys. I see some people, I've got a couple of messages. People are upset because I haven't been able to get to their questions, but we had to answer some questions from last time, and I still have 15 questions that I haven't even got to, but we did answer 20 of them in the Q&A. I answered emails and I've answered the questions from last week. So that's a lot. So I apologize if we didn't get to all of yours, you guys. We did as many as we could. Come back next week. The best place to ask these questions is in the Q&A, and I try to go through them in order the best that I can. If they're not completely related to type 2, I may come back to them, but just so that you're aware. Some questions about where you can find information about the program that we're talking about. This is the Diabetes Solution Kit, and you can find this at bartonwebinar.com. This is the program that Dr. Saunders and the Barton team have put together. There are 3 phases. Mostly it focuses on a low-carb diet, talks about stress reduction, exercise, etc. You can have the digital version of this for under $20, and you can have it today. So go to bartonwebinar.com if you do not have this. This is where the magic happens. It doesn't happen in the supplements. Dr. Saunders will tell you that repeatedly. This is where you start. If you are going to purchase anything, purchase this, okay? More than anything else. That is where the biggest success comes from. And so again, there's 3 phases in here. This is a really, really good program. Many people who are on the webinar have used this and had great success. We started the webinars just to support you along your journey with this. So it's a free webinar. We're here each week. You can come back and ask your questions as you go through this. We usually focus on different topics concerning type 2. Today, we just opened it up to just questions because we get so many, and we had a lot left from last week that we didn't get to. So I love this. Iman said, I had a blood sugar reading of 200 due to many cookies, took metformin and berberine, and the next day it was 95. That's good. I don't know if I can answer any of these other ones. Let's see. Oh, that's awesome. Okay. Stevia is an artificial sweetener. I mean, some people believe that it's natural, but Dr. Saunders says it kind of has the same effect on your body as sugar, where, in fact, I would just encourage you to go to bartonwebinar.com and listen to his quick little talk about the taste of sugar, the taste of sweet, and what that can do to someone that has type 2. It's very interesting. So all he recommends in phase 1, no sweets, nothing that has the taste of sweet, even if it's natural, unnatural, whatever. Okay. What do we have? Okay, Krish, high cholesterol will cause dementia, which is ironically considered as type 3, right? Conflicts with the high cholesterol. Oh, well, we'd have to ask Dr. Saunders that. That'd be a good question for next week. He said on a previous show that we should not use sweeteners or drink soda with sugar. So what should we do? Use sugar and drink normal soda? I'm not sure what that. You don't want to use anything sweet. No sugar. Let's see. How long should you be on phase 1 before going to phase 2? We actually just talked about that. If you guys want to go, if you're curious about phase 1, go to bartonwebinar.com. You'll find a link to our YouTube channel, and on that you will find our webinar. The title is called Phase 1. And we go through that. Dr. Saunders really wants your blood sugars under 100, and he would even say between 70 and 90. But that's when he would say you could move on to phase 2. In the book, we say under 100, but he's even tightened that a little bit. He said, let's go 70 to 90. So, okay, let's see, Rosalind, I know you have a big question. That'll have to be for Dr. Saunders. We answered the red wine. Antonia, bartonwebinar.com. That's where you can find this book. Again, use code webinar25. That is one word. You'll save 25%. Willow, sorry for the delay on your questions. I think we got some of them answered. Willow, we also have actually several webinars just about neuropathy that I think you'll find very interested. Again, bartonwebinar.com. You'll find, you can search our YouTube channel for neuropathy, and you'll find great webinars on that. Hello, Anku. We answered that one. Actually, we answered more than I thought. Hey, this is good. Okay, there's probably a lot in the chat, but I think we got to end this for today. Okay, so we have 2 webinars that we do each week. I mentioned that earlier. Come back tomorrow for our Healthy Heart webinar. In fact, one of you asked, Huki, I believe I may be pronouncing that incorrectly. I apologize, but that would be a good, that you might be interested in that, because I know you were asking about clearing the arteries. We do have our Healthy Heart webinar tomorrow, Thursday, 12 noon Central Time. And we talk about how to keep your heart healthy, how to reverse heart disease. And that webinar was born out of your desire for healthy heart information. Okay, anything else? Yes, okay, Roy, so the supplements are for deficiencies in our diet these days because of depleted soil on farms. Yes. Thank you for that. A lot of people come to our webinars or our program thinking they just want a replacement for their drug. And so they're looking for a pill. There are some people that have reversed their type 2 just through supplements. And the reason is because they were so deficient in that. Maybe it was vitamin D or like in cinachroma, we have the selenium, chromium. It could be those. Some people are so deficient in those that it reverses their type 2. Most people, it's just a too much issue. And so the diabetes solution kit usually works best for them. And then there are some people where those things don't work. And so Dr. Saunders talks about different testing that you can do. So we mentioned that a lot. Can you eventually get off all the supplements? You could. I think you could. Other than, for example, I know I'm always going to supplement with vitamin D and selenium, chromium, because I can't get those naturally, not in the amounts that I need. And berberine, they're just coming out with so many things about berberine and the anti-aging benefits of it, etc. I had said to Dr. Saunders, is there anyone who shouldn't take berberine? He's like, maybe not. So just a lot of good information that has come out about berberine. Okay, I think I better be done. I don't think I can answer any of these medical questions here. Oh, Julia had asked, you said autophagy, autophagy, I think is what you maybe meant. Autophagy, one word, ends with a Y. Sleeping on yes, oh, that's what you're asking. Going to bed on an empty stomach. So Dr. Saunders talks about the 6:10 reset or the 3:10 reset, and that is going to bed by 10 on an empty stomach, which means you need to stop eating by 6 at the latest. 3 would be ideal. And he talks a lot about the things that happen to your body when you actually go to bed on an empty stomach by 10. I often thought when I'm hungry, my stomach is eating myself. I know, I feel like someone taught us that. I don't know where that came from, but it's not totally wrong, right? Okay, if you get too low on blood sugar, I'm not sure. Okay, I better end. I better end. Thank you guys. We'll see some of you tomorrow on the Healthy Heart webinar. Otherwise, I'll see a good portion of you next week. Come back, ask your questions in the Q&A right away. We'll get to as many as we can. We're going to talk about phase 3. So we have talked about phase 1, phase 2. You can go back and listen to those. Go to bartonwebinar.com. Follow the link to our YouTube channel. Really good information about reversing your type 2 with step-by-step plans. We dig into the solution kit a little bit, and so that you can kind of see what you should be doing. And then we're going to talk about phase 3. There's a lot of you who've made it to phase 3, so we're excited to hear from you next week. Okay, talk to you guys soon. God bless.